Welcome to Code of Conduct training for the SEAS Group. As a team member of the SEAS Group, or a SEAS Group affiliated entity, you will be learning about the Code of Conduct that every SEAS Group team member is expected to model and uphold in daily work activities. By the end of this training, you will have an understanding of the core values of the SEAS Group, the underlying reasons we exist as a company. You will also be introduced to the Code of Conduct, which contains the business principles that the SEAS Group builds into all its operations at every level. By the end of this training course, you will become familiar with the company's commitment to ethical behavior, which includes our commitment to safeguarding the privacy of our patients and clients, as well as our commitment to our team members as we seek to ensure all who work with the SEAS Group have a safe and healthy work environment. Core values are the fundamental beliefs of a person or organization. These guiding principles dictate behavior and can help people understand the difference between right and wrong. The core values that define the SEAS Group are our commitment to integrity in our business principles and daily work activities, our pursuit of excellence by continuing to improve performance and quality, our dedication to compassion and respect for our patients and for one another, and our efforts to improve the lives of the communities we serve by offering access to expert care. How can you, as a team member, model these core values? First, start with follow-through, doing what you say you will do. Treat others the way you wish to be treated, with respect and kindness. Encourage team members' professional growth by encouraging them to express their ideas and opinions. Offer to help, even when it isn't your job. Be aware of the obstacles your community may face in improving health and be proactive in helping to find solutions. One of the ways we put our core values into practice is by establishing a compliance program, which is an overarching program that guides the way we interact with federal insurance products like Medicare and how we interact with other healthcare organizations or physicians who may refer business to us. Our Chief Compliance Officer oversees the compliance program, which includes not only policies and procedures, but methods for educating our team members about relevant rules and regulations, audits that are used to monitor how we're complying with those rules, and, when necessary, advice about corrective actions and discipline. The Code of Conduct is a part of our compliance program that sets the business principles that all team members are expected to abide by. The Code of Conduct guides our team members in how to conduct themselves when representing the company in any capacity. What is ethical behavior? Ethical behavior is defined as the behavior of employees with respect to what is right and wrong, and to what is good and bad in regard to conduct and decision making, not only in the workplace, but in life in general. We will look further into specific scenarios that demonstrate the ethics that SEAS Group team members are expected to model when faced with specific situations. We will also contrast those behaviors with those that are not consistent with our Code of Conduct and which could potentially lead to required corrective action. When we talk about ethical behavior, we generally mean doing what is right, what is honest, and having our actions prove our integrity. SEAS Group will demonstrate its integrity by the way it undertakes business relationships with potential referral sources and how we interact with those referral sources. Business relationships will be undertaken in a manner that supports quality of care, high levels of service, and fiscal stewardship. Lastly, SEAS Group will also conduct its business transactions in a way that is not fraudulent, wasteful, or abusive to any party involved, including, but not limited to, federal healthcare programs. When SEAS Group interacts with potential referral sources, which are the medical doctors or optometrists who may refer patients to us for services, all interactions will be done in an ethical and legal manner. SEAS Group does not pay for referrals, nor do we accept payment for referrals that we make. C's Group seeks to provide quality care to patients who are seeking our services for a medically necessary reason. If we are unable to provide the type of service or level of service a patient needs, we will not seek or accept a referral to provide that patient's care. When billing third-party payers, including but not limited to federal healthcare programs like Medicare, C's Group will only bill for services that have been rendered and which are supported by true and accurate documentation in the legal medical record. C's Group will not bill for services that are not medically necessary, nor will we bill for a higher level of services than those actually provided. All personnel involved in billing third-party payers will be trained appropriately and will be required to remain abreast of all current regulations governing how federal programs are billed. Each person who is employed by C's Group or who serves in the capacity of an officer or a director on the board of directors must do his or her best to identify situations in which a conflict of interest may arise, which may occur when an individual allows his or her personal involvement in a situation to influence his or her ability to make decisions in the best interest of the C's Group. In order to avoid even the appearance of an unmanaged conflict of interest, C's Group requires all team members, officers, directors, and medical staff to proactively disclose any conflicts of interest that may potentially affect his or her ability to make decisions to the sole benefit of the C's Group. C's Group will ensure appropriate controls exist to ensure financial statements are made in a timely and accurate manner. Actions that are intended to mislead or misrepresent those who rely upon the company's financial statements will not be tolerated. C's Group team members are expected to cooperate fully with any external auditor or investigation and will refrain from any action that would inappropriately influence the course of an audit into the company's financial records. Team members may give gifts to or accept gifts from business associates that are not referral sources, so long as the total annual value of all gifts given to or received from a single business associate does not exceed $75. Business courtesies given to or accepted from business associates who are not referral sources should be tracked in order to avoid exceeding the annual limit. Any medical doctor or optometrist who may potentially refer patients who receive benefits from a federal insurance program like Medicare or Medicaid shall be referred to as a potential referral source. Gift giving to potential referral sources is highly regulated and should only be undertaken in a manner that follows federal law. All gifts given to potential referral sources will be tracked, and annual limits on gift giving imposed by federal authorities will not be exceeded. Invitations to entertainment events will not exceed $150 in face value and shall also be tracked as a part of the annually limited value of gifts which may be given to potential referral sources. Through its compliance program, C's Group is dedicated to detecting, correcting, and preventing fraud, waste, and abuse. Fraud is typically defined as making false or fraudulent representations or promises in order to gain something of value in exchange. Waste is defined as overutilization of services that leads to unnecessary expenditure of Medicare resources. Abuse is defined as obtaining payment for items or services from a federal health insurance program where there is no legal entitlement to that payment. For example, billing for and obtaining payment for services that were never provided is considered abuse. C's Group is committed to putting in place systems that proactively discourage or identify abusive billing practices. Should you have concerns about practices that may appear to be fraud, waste, or abuse, please contact the compliance officer at 1-615-649-0988 at extension 20225 or call the compliance hotline at 1-844-761-7267 immediately. Let's test ourselves to see how well we know how to apply what we have learned so far. In this scenario, Trina is working late to ensure the diagnosis codes assigned to a patient's medical record are correct prior to submitting a bill. Trina sees that the only diagnosis code on an order for fundus photography is glaucoma screening, which she knows will not pass medical necessity standards established by the local coverage determination. Trina is under a tight deadline to bring down the amount of unbilled accounts receivable and considers finalizing the bill anyway, even though she knows the diagnosis of glaucoma screening is not covered by Medicare payment policy. What should Trina do? Trina actually knows the patient in this scenario personally and is aware that the patient has macular degeneration. Trina adds the diagnosis code for macular degeneration to the physician's order for the fundus photography procedure. Is this the correct thing for Trina to do? No. Remember that fraud is intentionally misrepresenting facts when submitting claims to a federal insurance program in order to obtain payment. Trina has intentionally added documentation to the claim that the ordering physician did not include, thus misrepresenting the claim to Medicare. This is a bad decision. Instead of relying upon her personal knowledge of the patient to change medical record documentation, Trina knows she must submit a question to the physician who ordered the fundus photography procedure and ask if there are other diagnoses that support the procedure being performed in addition to the glaucoma screening diagnosis code. Trina submits the question to the ordering physician, who directs Trina to other clinical information in the patient's chart that supports the diagnosis of macular degeneration. The diagnosis code for macular degeneration is then added to the claim at the direction of the physician, and the claim is submitted to Medicare. This is the right approach, and Trina made a good decision. We find another team member working hard to bring down the level of accounts receivable, but Mary, the manager, realizes she needs reinforcements to accomplish this task. She asks Bill to bring in contract workers to help her catch up on the backlog. Bill agrees to contact several contract agencies he knows, but doesn't tell Mary that one of those agencies is actually owned by his brother, Mike. As soon as Mary leaves his office, Bill calls his brother Mike to offer the contract for temporary contract worker placement to Mike's firm. Bill doesn't obtain any other bids for the work, but promises to pay Mike's firm an amount that is almost 25% over the price that he would pay other firms in the area. Instead of sending the contract through the regular purchasing process, Bill decides to sign the contract himself so he can get Mary the help she needs. Did Bill do the right thing? No. Although Bill was trying to get Mary the help she needs, Bill should have disclosed his relationship to the owner of the business, his brother Mike, to Human Resources. Let's take another look at how Bill could have handled this situation. After hearing that Mary needs help, Bill reaches out to purchasing and asks that 3 bids for contract services be obtained for local vendors. Purchasing brings 3 bids to Bill for consideration, and Bill realizes that one of those bids is from his brother Mike's company. Bill contacts HR and completes a disclosure of conflict of interest certificate, and then notifies his boss that his brother is one of the competing bids to provide contract labor. After reviewing all 3 bids, Mike's company is awarded the contract work since Mike's bid was the lowest price. Bill's boss signs the contract with Mike's company, and Bill has remained outside the negotiation process. Derek is attempting to market the services of a specialist practice to area physicians and optometrists. Derek also wants to ensure that conversations with potential referral sources are handled correctly, but he knows that volume is significantly down for the quarter. Derek thinks he can get a ticket to an NHL playoff game, but is a little concerned about funding a trip to Hawaii. How should Derek approach this situation? Caving under pressure, Derek calls a friend who is able to line up 2 playoff game tickets for the optometrist and his wife. When Derek delivers the tickets to the optometrist, Derek hints that he may also have an inside scoop on getting the optometrist to a seminar in Hawaii if referral volumes pick up. What is wrong with this scenario? Almost everything. C's Group will never pay or even make the appearance of paying in cash or in kind for patient referrals. When the optometrist originally raised the question of receiving something of value in exchange for referring patients to the practice Derek represents, Derek should have politely excused himself from the conversation. Let's try this scenario one more time. When the optometrist hints that he may be willing to change his referral patterns in exchange for some cool premiums, Derek politely tells the optometrist that the practice he represents prides itself on its quality of care and is happy to treat patients who require the practice's medically necessary services. Derek goes on to indicate that the practice will always seek to improve its quality, ease of access, and patient satisfaction in order to earn the optometrist's trust, but that the practice does not offer premiums to referring physicians that may be perceived as inappropriately influencing referrals. As part of C's Group compliance program, we uphold our commitment to safeguarding the privacy of our patients and clients. We realize our practices would not thrive if we didn't earn and keep our patients' trust. We do that not only by providing high-quality clinical care, but also by being trustworthy with how we treat patients' confidential health information. In each of the above scenarios, a lab worker sharing test results with her mom and sister, a tech looking at his mom's lab results in the electronic medical record, or 2 employees posting photos showing the results of a patient's surgical procedure, trust between the healthcare provider and the patient was irreparably damaged. If you were these patients, would you return to those providers for additional care? Probably not in most cases. What should we be doing instead? Simply following the golden rule. Recent surveys show that patients don't place implicit faith in their healthcare providers. 89% of patients don't share key information with their doctors due to fear of a data breach. Potentially more devastating is the fact that up to 65% of patients will change providers if their provider has a HIPAA breach. How do we make a difference in those statistics? The difference always starts with you and the decision you make and how you treat patient confidentiality. Just as severed trust can cause patients to withhold critical health information from providers due to a fear of breach of privacy, earning a patient's trust daily can create a stronger bond between the patient and the provider and make the likelihood of the patient choosing to leave the provider's practice much less likely. Those of us working in healthcare for any length of time are already acquainted with the HIPAA privacy rule and the HIPAA security rule. The privacy rule protects 18 elements of protected health information, which may be anything from the patient's name all the way down to his medical record number. Healthcare providers must take physical and administrative precautionary measures to ensure these pieces of protected health information aren't accessed or used inappropriately. The HIPAA security rule puts national standards in place for how electronic protected health information must be protected. This rule becomes more and more important as practices rely more heavily on electronic medical records. Means of protecting electronic protected health information include, but aren't limited to, proxy badges, firewalls, virus scans, and username and password login credentials. How do we ensure we are abiding by the HIPAA privacy and security rules? Follow a few simple rules of thumb. Keep all information that you gain through your employment at SEAS Group, whether that information is clinical or business related, confidential. Do not snoop into patient records. If you aren't involved in the care of the patient's path through the practice, from registration to clinical care to billing the patient's account, then there is no reason for you to be accessing the patient's medical record or to be discussing the patient's protected health information. Do not share the username and password you have been assigned for accessing the electronic medical record. If inappropriate access or inappropriate documentation is found, you will be held accountable for those actions taken in the medical record under your account credentials. Remember to encrypt emails that may contain protected health information or other sensitive information when sending emails to an outside server. It's important to know the basics of laws like HIPAA and to understand our obligations under company policies and procedures. It is equally as important to understand the value of earning and keeping our patients' trust. Let's think about what we have learned so far. In this scenario, Joni, a reception at the Center for Facial Rejuvenation, is contacted by her sister Melinda, who is looking for some juicy gossip about their mutual friend Carla. Melinda says Carla may have had some work done and wants to know if Joni can verify if Carla is a patient at CFR. What should Joni do? Joni decides to satisfy Melinda's curiosity and logs into the electronic medical record to see that, yes, Carla was a recent patient at the center. She shares this information with Melinda, but asks her not to repeat it. Is this a bad idea? Absolutely. Not only is snooping into a patient's electronic medical record against state and federal law, if Joni is a licensed or certified health professional, choosing to snoop into patients' protected health information can be a career-limiting decision. Since 2013, adverse licensure actions are being taken by state licensing boards more and more often when health professionals have been found to be snooping in patients' medical records. What should Joni have done instead? She should have simply reminded Melinda that she can't and won't comment on patient information, not only because it is against the law, but because keeping patient information private is the right thing to do. What about this scenario? John, who works as a tech in Birmingham, is married to Ellen, who is involved in a custody dispute with her ex-husband Brian. John knows Brian has a serious medical condition that may impair his ability to care for his children from his previous marriage to Ellen. Should John tell Ellen what he knows due to his position as an ophthalmic tech? John thinks he can help his wife's custody case by sharing the information he has. Loyalty to your spouse should always trump loyalty to others, right? In this situation, wrong. Instead of even putting himself into the position of knowing Brian's medical information, John proactively tells his supervisor that, due to the conflict between John's wife and Brian, he would prefer to remain uninvolved in Brian's care, if at all possible. Not only does John avoid accessing Brian's medical information in the electronic chart, he also avoids verbally discussing any of Brian's protected health information, avoiding any conflict of interest, as well as insulating himself from any potential claims Brian could make, however untrue, about John inappropriately sharing his health information. Part of our code of conduct is ensuring we are following through in our commitment to team members by providing a safe and healthy work environment. Our commitment to our team members means we treat one another with respect, consideration, and courtesy. Any form of bullying will not be tolerated. Conversations will be respectful and appropriate for a professional environment. Discrimination based upon one's race, color, age, gender, gender identity, sexual orientation, religion, or any other factor protected by law is prohibited. What have we learned about our expectations for the work environment? Consider the following scenario. What if you overheard the following situation? 3 physicians, 2 males and 1 female, are having lunch in the break room. One of the male physicians begins to share an off-color story with the female physician, who is laughing as she listens. The other male physician speaks up and says he finds the story offensive and that he doesn't want to hear any more. What should be the outcome in this situation? A bad outcome would see the storytelling continue, while the physician who objected to the story is chided for being a prude. The outcome that we want is that the objections of the male physician who doesn't wish to hear the story would be respected. Even better, give the guy an apology for the offensive story and vow to do better next time. By this point, you may be asking yourself how all this information applies to you. The answer? We all need to know the rules of the road in order to successfully reach our destination. Knowing those rules helps us avoid pitfalls that may lead to undesirable patient outcomes, loss of ability to bill Medicare, or poor employee relations. Knowing the rules also allows us to identify when a situation isn't quite right. The next step, then, is speaking up when you see those situations that just don't feel right. In the next section of the training, you will learn why speaking up about situations is so important and why speaking up is something that everyone should feel comfortable doing. Why speak up? It reaffirms our trust in each other, our leadership, and our organization. When fear of retaliation for speaking up is removed from the equation, mistakes can be identified and fixed sooner rather than later. Although speaking up can seem difficult, by building an environment of trust and criticizing the problem or process, not the person, we can continue to improve as an organization and as a team. What happens when you choose not to speak up? Mistakes don't get fixed. Actions continue to be taken on bad information. The company may be subject to penalties or fines. The time used to fix the mistakes distract us from our goals, wasting time, money, and energy. Worst of all, trust is damaged and people may even be hurt. So now that we know all the reasons why we should speak up, what are the things to look out for? Those things we should speak up about. When we are billing for care that wasn't rendered or documented, speak up. When you see retaliation against someone who has raised a compliance concern in good faith, speak up. If you see bullying, harassment, or discrimination, speak up. If it just doesn't feel right, speak up. The decision to speak up is an important one. Now, where do you go once that decision is made? Remember, there are always many ways to raise a concern. You can choose to speak to the person directly involved, which gives you a chance to make sure you understand the issue and that your concerns are valid. We realize that might not always be possible, so for those situations, consider speaking with your supervisor, calling the compliance officer, or the human resources director. You can also report an issue anonymously by entering the information into the Ethics Point portal found at the link above. Lastly, you may call the compliance hotline, where concerns may also be reported anonymously. No matter how you choose to speak up, know that you are protected from retaliation of any kind when reporting a concern in good faith. Protected by the company's policies, by personnel in compliance and human resources who seek to investigate issues while protecting the privacy of those involved, by state and federal law that make it illegal to retaliate against those who report concerning issues with legal or compliance implications. If you are a leader, you have additional responsibilities. Remember to urge staff to speak up about conduct that may be illegal, unethical, or improper. Once the staff have done so, protect the staff from any form of retaliation and notify compliance promptly if any activity, even resembling retaliation, occurs, even the cold shoulder. Speaking up can seem scary, but it is something we are all responsible for doing. As we continue to speak up, we continue to build trust in our company, our leaders, and one another. Find your voice, and if the time comes, speak up.